Assalamu alaikum guys, welcome back to my YouTube channel. In this video we will discuss USA health insurance system. How does the USA health system work? Healthcare is in the United States is organized in a complex bureaucracy. While in the rest of the world, healthcare facilities are owned mostly by governments or by private sector business. In the US, a large share of hospitals and clinics are owned by private non-profit organizations. Yet the United States is the country the that has the highest healthcare expenditure in the world. While these expenditures are covered in a large share by public payers as by federal institutions or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed in nation, the US health system does not provide health care to its entire population. As there is no single nationwide system of health insurance, the United States primarily relies on employers who volunteer provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare experience from the fragile part of the society as the elderly, disabled and the poor. These programs differ from one another and all have a specific kind of pupils that are subject to. Getting health insurance in the US is not an easy thing. Someone may think that once you have money, everything is easy pesa. But in fact, things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all its people, and health insurance is not obligatory for those living in the US. It is optional but highly recommended and necessary since health. There are two types of health insurance in the US, private and public. Most people use a combination of both. The US public health insurance are Medicare, Medicaid, and Children's Health Insurance Program. Travel, hen- Travel insurance for visitor in USA, health insurance for international students in USA, health insurance for dependent of international students, health insurance for J1 visa holder, health insurance for foreign workers on a H1B visa, health insurance for dependent on an H4 visa holders, health insurance for green card holders, health insurance for K1 visa holders, health insurance in USA for Canadian expats. The US has the most expensive healthcare in the world. That's why getting adequate health insurance cover comes highly recommended. Medicare. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for US nation older than 65 years old but also for younger people with an stage renal disease, ALS and some other disabilities. Data shows that in 2018 Medicare provided almost 60 million individuals with health care in the US, over 51 million of which were older than 65. The Medicare program is divided into four parts. The first part is called A, which cover hospitals, skilled nursing and hospice service. Number 2, cover outpatient service including some provider service, while impacting at a hospital. Third one is an alternative called managed Medicare, which permit patient to select health plan with at least the same service coverage as Part A and B. Often the benefit of Part D and an annual out-of-pocket spend limit which A and B lack. To sign in this part, one must sign in Part A and B first. Part D cover mostly self-administered prescription drugs. So guys, in this video we will discuss health insurance. The first part is Medicare. Medicare's also have a sub parts 4. We discuss these. If you find this video informative, please like or subscribe my YouTube channel. We will meet soon in the next video. Allah Hafiz.